Okay, so a very good morning to everybody. And I think one of the most important things that we as doctors want from our patients and our patients also want is a very smooth process in which we are obviously able to help you properly and certain prerequisites or certain ways that you can help us uh, is always better. So it's more than a do's and don'ts. I think it's more of a list of things you should always try to do, or you might be asked to do, which will be helping, of course, me as a doctor, and of course, you as a patient. So the first very important thing that we as doctors will do is we will ask you about yourself. So this is what something known as a history. So, I mean, so it's very important that whatever leading questions we ask, you are able to give a good answer to it and try to give the most honest answer, because history is very important in which we are able to know. Then a chronological order is always something which we'll ask. तो इस टाइम पे क्या हुआ था, इस टाइम पे क्या हुआ, फॉर एग्जाम्पल अगर दर्द है तो दर्द कब हुआ था, कब से है. So all those things are very important because it helps us in analyzing that what exactly could be your situation. Then secondly, while we are asking, if you also have certain questions you want to ask, just keep it written so that it becomes easier, that you don't forget to ask us about the history that you have. Then secondly, okay, after going to the details of course your complaint, we will want, very important is the past history. Now a lot of people sometimes when they visit for the doctor for the very first time think that my complaints currently are this, what is the past have to do with it, and isn't it a waste of time? No, the past history is very important because it will tell us the chronological order in which आपको कौन कौन सी बीमारियां हुई थी, कैसे हुई थी, कब हुई थी. So then it gives us a very good idea of your earlier. For example, if you had a history of heart attack now and you're having chest pain now, so I will obviously put heart disease very high. Then of course, previous investigations and reports, it's always better to carry it with you so that we are able to see it in the first visit itself. Now another very important thing is your doctor patient relationship is very important. So you don't worry that what you tell us, we are not going to tell anybody and everybody. It's a privileged communication. So do not try to hide anything in your uh, past history or conceal anything, because it becomes very difficult. For example, if you have a history of tuberculosis or a history of epilepsy or something which you would be major but you want to hide because you feel it's a social taboo, do not do that. Honesty is always the best policy. Try to tell us everything, and we will obviously ask you about your drug allergies. But if you already know about it, do not forget to actually tell us also about your drug allergies that you might have. Then the doctor will obviously, again, I will ask you more a lot of about your social history and personal history, because a history of smoking, drinking, all those things is very important. So try to give a very honest kind of this and that, because then only it will help. Then of course we would take your permission and we will examine you as well. If it's a female, usually we do it with another person, female person in the room, and not necessarily the relative. We always cause for a nurse, because the relative is still, even if it's a female, it's still your relative and it's not a outside person. So we try to get you very comfortable in that. And then of course, after confirming what we have in our mind and explaining to you, that is when we will try to give you a diagnosis. So you are obviously in a full right at this time to actually, I will obviously be explaining to everything, but if you have any questions, queries, I would obviously ask you and want you to clear off. Sometimes queries do not come immediately because you are still thought processing. So obviously in the next visit, you should sort of write them down so that you can obviously get them answered, because answering your queries is what we are here for. It's not something that eats into your time. It is very important. But at the same time, try to focus on your disease process and not only what Google says, because a lot of times these days conversation is more about on what online thing says, rather than what you actually want to know. So knowledge is good, but knowledge which is not sort of certified will not help you in any way. Then, of course, another important thing is after the prescription is given to you, we always, I always explain the drugs, I always explain how you should take it. If you still have doubts, if you're not understanding, you are in full right to ask. And please try to ask and understand. If you feel you're not registering, that's why we always say maybe a important do is to always have a caregiver with you who will also understand, because if there are two people who understand and you, if you forget something, at least they will be able to sort of remind you, no, this is the way doctor had said to take things. Then another important thing is follow-up visits. When we actually advise you for a follow-up visit, it is with a plan. Of course, certain times you might not be able to come because somebody was not available, or maybe you're not able to come alone, or maybe because of transport or whatever. But it is always better that you inform the doctor that you're not able to come, because whenever we plan follow-ups, we always think of a plan. It's not that we just are saying that, okay, you can come in 1 month, 3 months, 6 months. Of course, if you have some chronic diseases जिसको लंबे अरसे में हमें बस देखना है, then we might call you later depending upon the condition. Now remember, you always, there is a general tendency, I'm not saying everybody does. General tendency is to just think that it is more about what the doctor will advise. Remember, the doctor visit is not about the doctor. It is about you and the doctor both. So we are a team. I will be only able to diagnose what you have if you're giving me correct information. So it's a collaborative effort in which I will explain to you everything. At the same time, I would want absolute honesty. Now, a little effort from your side will always help in giving you the best possible care. Now, I always say, as far as patients who come to me, I have certain prerequisites which are very important. You should always bring your past medical history, because I think that is very, very important. Then a list of your current medications. I always love to see the strips, because if you show me the strips, I'm able to see the content immediately and maybe even tell you to stop, because there are a lot of similar sounding drugs. For example, there is a drug for depression which is known as escitalopram, and there is a drug for sleeping which is known as etizolam. So all it has is a difference of an A and an O. One is 5 milligram, one is 0.5 milligram. So if you end up taking the wrong drug 10 times more, then it's all trouble. So you should always try to ask. And there are certain challenges you'll be facing. For example, maybe the small size on the strip, difficulty to see, difficulty to open the drugs. Maybe you're not even taking the drugs yourself, your relatives are giving it. So that is also something which you should remember. Then another thing is, please bring your glasses along with you. The general tendency a lot of times is you only carry your glasses sometimes if you are going to the ophthalmologist only. So please carry your glasses, because if you have a problem with that, we obviously will be able to rectify. And of course, you will want to see me and you will want to be more comfortable. Always carry your hearing aids, because the hearing aids is very important, especially if you're not comfortable with them. And if you're comfortable and not wearing it outside, then of course you might not be able to hear anything I say, so that will not help the consult. uh, then also bring your teeth. Now the question is, if you have dentures, so the older adults might say that, no, but why to the hospital? No, because if you're having an issue with the dentures, you should explain what the issue is so that we can get it rectified. Then of course, names of your doctors who have been treating you, not because we need to know who has treated you, but because we can coordinate with them and not repeat certain things they might have already told, because ultimately it's a group of doctors who must be treating you, so it better becomes to coordinate. Then another very important thing which is always sort of important is your family history. Now if there is already a significant family history, it helps. Now, I mean, most older adults, let me be very frank, are very organized. They almost have an entire life history, a big paper starting from the time they had actually had major illnesses, and they literally put it in a milestone form and sort of bring it. But sometimes certain people might not be able to do it. It depends on how healthy they are. So the relatives sort of bring it. So the I would say more organized you are before the consultation, the more easier it becomes during the consultation. Now that brings me to one of the most important things which is happening now, and that is video consultations. Now it's very important that during video consultations you are very much even more prepared. Now by more prepared I mean all those things you obviously have booked an appointment. It's very much the same. Remember, video consultations, there might be another person after you also waiting for that. So it might not be like a normal consultation in which we can go on to half an hour, 1 hour, 2 hours. No, that might not happen. So things have to be cut off. So what you need to do is, one is beforehand itself, of course, you would have contacted the doctor. This is the appointment. So before that, maybe 24, 48 hours before, send your investigations through email, send the details of the medications and all these details uh, which I told you, so that it's already in. I mean, and I will already have. So see, it's like preparing for a meeting. If I already have the knowledge, then I am only concentrating on what you will want to say. At the same time, try to ask you more questions. Now, another thing which always helps is the list of medications which I told you, because now you might not be, and but keep it with you. I am not saying since you have already sent it to me, you should not keep it with you in the video consultation also. I think it's very important that you keep it with yourself, because I will be able to still see if you want to sort of show it to me. Then your vitals, because see, the biggest difference is I am not able to physically examine you in your video consultation. So these days everybody has a blood pressure monitor, everybody has a saturation monitor. So the pulse rate, heart rate and saturation is monitored already. So if you can monitor it before the consultation and keep, then I am already having a baseline. Then very important that you have your assistive devices like your spectacles, hearing aids. You might have to show me you actually as walking as well, how you're walking. So your stick, everything should be there so that I can see you walking, and whatever tests I will try to do. Now very important is, please try to get a caregiver in with you, a relative who is going to try to help you out if you're not able to do it. I'm not saying older adults are not technologically advanced. You always want a caregiver. So only one. Remember, since it's video consultation, doesn't mean that you'll have 4 or 5 people joining from all over the world. That is not fair on the consultation, purely because I am here to make sure I know what you have and to try to cure you, and then explain to your relatives, rather than everybody asking me questions and me not being able to focus on it. So that is important. Another thing is, with your permission, usually the consultation will be recorded as well. Now this is again a recording which is very much a doctor patient sort of this. So this cannot be seen by anybody else. It is only going to be seen by me. So that is something, of course, a permission is always asked by Zoom, if you see. Now various platforms are there. Zoom is not the only platform. So I wouldn't say that learn everything about it. If you're not able to, then of course you'll have to have a facilitator, which could be your relative. Now, in most video consultations, of course, the payment is already made. So it's not different. You go to a hospital, the payment is already made before you see the doctor. So that's the way it works. So it's almost pretty similar. Now, time wise, sometimes video consultations, I mean, of course, in the first appointment itself, I say that this consultation might go into 2 consultations, because it might be half an hour split into 2. Because sometimes technological challenges, purely because when you actually have a sort of a hearing problem or a vision problem, it might take more time. So these prerequisites, I think, for a video consultation are very, very important. Another thing is, if you do not see, I'll give you will get a Zoom pass or whatever platform. Please, please do not just just sort of spread that to 4 or 5 people, and the doctor is also not knowing that how many people are joining. Ideally just one relative is enough, purely because I mean that should be enough, and it can be anybody. If you're going to get more, please inform the doctor beforehand, so that he is obviously prepared for the same. Not because that's the way it happens even in hospitals, that a caregiver is there, but try to get a caregiver, because sometimes you might not sort of uh, enjoy enjoy the fact that it's a video consult and you might not be very secure. See, video consultations are one of the best ways that now I have been able to reach out to people who are bedridden, which I couldn't do unless I could do home visit. Now the physical element will always be missing. That's why I would always say a video consultation is not a substitute for a physical consultation. So if I tell you that no, things don't look good, you need to visit a doctor in person or you need to visit me in person, then that has to be done. And that's very much the norm even during COVID. If there is an emergency, you need to rush to the hospital, irrelevant of whether COVID is there or not. Because in future, video consultations might still continue. We are not very sure, but it might still continue because, for example, people who are just have to continue the same drugs, or they don't have a lot of issues, they feel that they don't need to come. Earlier it was them canceling the appointment and changing it. Now it can just be a video consult in which you sort of just tell the doctor what you're having, and then of course now the prescriptions you will get. Now after the video consultation, of course you'll get the prescription signed by the doctor. A lot of them do it through softwares, a lot of doctors do it directly. It could be through WhatsApp or it could be through email. Another thing I would advise in general is WhatsApp just gets overloaded. So always try to send through mails, because sometimes it's very easy for anybody, forget a doctor, because there are so many groups, there are so many messages, to miss that. So an email is always better, and your doctor would obviously explain to you before that this is the mail that you should be sending things off. So I would say for the best consult with any doctor for a good diagnosis, it's not only the doctor who is important, it's the patient being prepared for the consultation. And in older adults case, I know not everything is going to be simple. Things can be complicated. So something which can be sent before, well and good, that's okay. Now in physical consultations, just sending everything online beforehand might not always work, because ultimately physical consultation is different. You might have physical reports which you want to show. So that's about the do's and don'ts. So I think in overall I've just told you what you should do and what you should not do. Try to, of course, if you have any other questions in particular, you can ask me. Thanks a lot for your patient hearing.
Thank you very much, doctor. Any questions? Please unmute yourself, ask your question, or write it on the chat. Anybody has any questions, you can unmute yourself.
I think I saw raise hand actually.
Yes, yes, Mr. D'Souza. I think it's doctor, let me ask you a question. What should you not discuss with your doctor? In other words, should I discuss my mental health, or should I not? Should I if I go to, let's say, orthopedic surgeon for consult, should I discuss my blood pressure problems? What should I not discuss with the doctor?
See, a lot of it's actually very difficult to say, because for me, when I consult with older adults, I do not stop them from telling any problems. I know my limitations, where I can help them, where I cannot. So that's usually the case. Now, what happens is, yes, when you're going to specialists like maybe orthopedicians, and you might not want to ask them questions in which they might not be able to contribute. For example, something about the heart medication, they will only tell with the knowledge they have, but they are not a cardiologist or they are not your specialist. So maybe that might just eat into your consultation. But to be very frank, that cannot be particular do's and don'ts, because sometimes it has been seen also that when you go to an orthopedician, you can also suddenly get high blood pressure and you need help. So I wouldn't say that you shouldn't sort of express that if you're actually having an obvious sort of feeling. But even the doctor to an extent will sort of try to obviously counsel you and get back to the point which you want to. And it's not always, I won't say it's your fault. Sometimes you just want to tell most things. As far as I am concerned, I usually ask about everything. And then as we go ahead with future consultations, I know you more. So I'll obviously able to know more. Now, as far as mental health is concerned, I think you should express it, because half of the time people don't even express it. And I mean, I ask leading questions, so it becomes easier to people to sort of express. But sometimes you might not even tell me, because mental health questions might not be very comfortable on the first visit. So as you come more and more, then the patient tends to express a bit more.
Yeah, no, doctor. Something came out of yesterday's discussion wherein the trust factor is involved, and you cannot reveal everything because the word reaches far and wide, and there could be a stigma attached to your medical condition. So, whether you would want to really speak all that out was the question that came up yesterday.
See, as far as trust, when you decide to go to a doctor, you actually go to a doctor because you have an element of trust. And the doctor is obviously try to treat your medical condition, and obviously try to maybe cure you, or to be very frank with you that these are the things which are possible and these are not. Now, as far as stigma is concerned, unfortunately stigma is created by society and not necessarily by the patient or the doctor themselves. So I would say that ultimately, if you feel any kind of stigma, you should be open to the doctor, because they'll be able to help. If you think you're not comfortable, then you should be open to whoever you are comfortable with. Because ultimately, I think the doctor patient relationship purely works on trust. Because if you don't trust a doctor, then you're wasting your time going to the doctor. And at the same time, the trust comes from the patient doctor as well, because when we prescribe something which is only going to make you better, you obviously expect that you will be sort of trying to follow those things, because it's a team effort. I mean, we both are trying to work towards a common goal, that is to make your health better.
Mm-hmm. Thank
Any
you,
other
doctor.
questions?
Saleh, you can mute me.
If anybody has any questions, or we will end this session. Doctor, thank you very much for this. This has been very helpful. I think a meaningful conversation with a doctor is worth its weight in gold. I know how important it is that the doctor actually should get all the information so that he can make a proper, informed diagnosis. And I think this has been very helpful. Thank you once again, doctor. Bless you for what you do for us. And again, the video of this will be uploaded on our website. Please do have a look at it again. See you again next week.